to why the National Party have a problem in the bush in terms of healthcare, and reminding us also about the stupidity of this government. Now, when Malcolm Turnbull got elected to be the Prime Minister, there were those of us in this place who thought we might actually see something different. We might see some change in public policy, and we might move on from the 2014 budget with its cuts in health. There was a valid expectation that the $57 billion worth of cuts to the hospital system would in fact be reversed, that he got the message from the community that, Malcolm, this is not acceptable. And why did the member for Warringah end up being necked, after all? Because of the 2014 budget. So he's necked because of the 2014 budget. The Prime Minister, the current Prime Minister, sticks to the initiatives of the 2014 budget. $57 billion worth of cuts to the public hospital system. Now let me explain what that means to those opposite for regional communities like my own. The Alice Springs Public Hospital, 80% of its patients are Aboriginal people. If you put together the cuts to the hospitals with the proposals to 3 attempts of the GP tax and co-payments, what they're doing is attacking the most vulnerable people in the community. And the government talks about its desire to close the gap. What they will do if they actually get these things into law, if they get them through the Senate eventually, if there's a change in government, if there's a change at the next election and they control the Senate, this will penalise the weakest in the community and the sickest in the community. The sickest in the community will be asked to pay more for their services. And these are people with massive chronic disease problems who need to regularly see the doctor, who need to regularly have pathology tests. Now, how the hell do you expect to close the gap if you actually charge people so much as they will defer the intent to go to seek assistance from a doctor or go and get a pathology test? Pathology tests which are ultimately very important. And we know the level of chronic disease in the bush. Enormous problems with diabetes. One community I went to recently, a 7-year-old girl with stage 2 diabetes, looked after by an Aboriginal community-controlled health service. You attack these GP payments in the way in which it's been proposed, that health service will cost that health service and its ability to be able to deliver health outcomes for those communities. Now, be very clear about this. This is not just a matter of talking about who is fiscally responsible. This is talking about what is fundamental to most Australians, their health care, and the universality of a health care system, and the importance of that universality to making sure all Australians, regardless of who they are or where they live, can get good access to the same level of medical treatment whether they live in Alice Springs, Dubbo, or Utopia in the Northern Territory or in Sydney. But what we're seeing here is a deliberate attempt by this government to hit the weakest, the poorest and the sickest in the community. And now we've got this stupid proposal, absolutely asinine and stupid proposal, to cut the kids' dental scheme. Now look, I'm not a doctor, but I do know some things. I do know